Hello, my name is Amelia Hasty Rose, and I am presenting my presentation on the social worker's role in the end-of-life care. Hospice matters. The end of life deserves as much beauty, care, and respect as the beginning. What is end-of-life care? End-of-life care is an important part of palliative care. It is the care of a person during the end or last part of their life, and it may be referred to as terminal illness and terminal care. Palliative care and hospice care. The goals of palliative care are to relieve suffering while providing the best quality of life for a patient or their family, which can be at any age or any stage of that patient's illness. It can focus on intensive symptom management, communication, and the coordination of that patient's care. It's not limited to any to end-of-life care. Not dependent on a prognosis, and is provided along with the curative treatment. Hospice care goals are to provide patients with who have a life expectancy of less than 6 months care, and there is also to help the patient to have comfort while they are transitioning. It's either in their home or in the nursing facility. It's the patient's choice. It's to focus on caring for the patient, not curing. It helps with pain, to assist them with their pain management, providing comfort for them, and emotional support for the family or that caretaker. Special population that I chose is pediatric end-of-life care. Here are some of the statistics that I found while doing some research on pediatric end-of-life care. I won't read through all of them, but here are a few I found interesting. That approximately 90% of pediatric deaths in the hospital occur in a neonatal and pediatric intensive care unit. The serious illness and death of a child is one of the most disruptive events in a family's life, especially when the family is raising young children. And I think that's because they're thinking like, okay, how are we going to deal with the other children at home, or are they thinking about like, will we be able to have another child? Just all kind of things are probably going through their minds during that time, during that that grieving time. It could be blame. It can be a number of things. Here's some more vital statistics that I found while doing some research where things have advanced. Pediatric end-of-life challenges. Here are some of the challenges that I found. That the end-of-life care with pediatric patients has been considered to be particularly difficult, as it typically is typically considered against the natural order for children to die before caretakers. So the challenges that families face are communication. The communication is when to share with that child or that sibling the life-changing events that's going on. There's a problem or issues when they exclude them from the discussion, and also not preparing them for those important life events that's going on in the name of kind of protecting them, which can also lead to adverse outcomes. For example, when they don't include that child or that sibling in conversations about the medical condition of their ill sister or brother, that can cause that child or those children to have ill feelings or resentment of and feel the feelings of being isolated. One of the other challenges that I found was decision making. Having the differences in cultural and health beliefs. The causes and conditions may be an issue. The spiritual healing, their beliefs, their spiritual beliefs, religion beliefs, that they may believe that they might not want to accept medication, It's different things that they may not want to accept because they may believe in a higher power of healing, different cultural backgrounds and beliefs. Everything with the decision making can kind of be different. Those have been challenges for with families. Some of the ethics have also been an issue and a challenge. And parents, including the patients, in their care and decision making. Parents have the right to the legal right to make decisions concerning the minor's care, but the parents and clinicians should not simply exclude the children from the discussions and decisions about their care. So it's important that they do include them in on if they're at that age, a developmental stage, and that age to understand, but what's going to happen with their own body, and in that process of knowing, like, if it's going to hurt, or if they're going to go through what kind of surgeries they're going to go through, just letting them have a kind of a say so and know what's going on with them. Social workers' role in preparing to address the challenges and needs. So some of the things that I saw that how I would feel that I would address those challenges and needs are to facilitate communication by providing support, education, and family-centered counseling, assisting the patients and family with the where they may be experiencing as the child approaches the end of life, having the understanding of their illness, helping that child understand their illness or the siblings' illness, which I talked about before, vary based on their developmental stage. Create a family-centered care perspective to encourage patients and family involvement in decision-making around health concerns. Resources needed for, I feel that I would need as a social worker in working with the family. Self-care strategies, I feel, are crucial in order to continue to cope and strive in working with patients during the end of life care. And then also training. It's important to have that training to serve these patients, this population, to help them with their complex needs. And then also supervision. It's important to have that supervision on a regular basis to help process cases and issues with specific concerns and things that may come up. Interdisciplinary teams to discuss concerns and process cases as issues with families come about, and then provide that communication, keep that constant communication between the professional team members going, because that's important. Some of the resources needed by that family or that patient could be that the children and their families require end-of-life care that is family-centered and caters to the individual's needs of all family members. Overseeing the treatment planning, that's important. Provide support to deal with their loss, the acceptance, bereavement, and grief counseling. Communication with the interdisciplinary team. Provide that. The social worker going back and forth, because it's important that family stays up to date on what's going on. So communication with that family is always important, because sometimes they feel left out, and they communication and information is always kind of not given to them the way it should be. So we want to make sure that we communicate with them on a regular basis. Coordination of patients' health care in addition to the psychosocial and caregiving needs, and also just being an advocate for those that patient and that family. Social worker skill set. Now, here are some of the skills that I feel that that a social worker will bring to the setting. Medical social workers are well suited to be the healthcare managers. Medical and public health social workers receive training that prepare them specifically to provide psychosocial support to people and families coping with chronic or terminal illnesses. They are able to see the patient through a broad lens, see the patient's physical needs as well as their medical needs. They have the skills to educate and counsel both patients and caregivers using family-centered perspective. And the healthcare manager actively listens to the patients and works with the patient to create concerns as well as an advanced directive. Here's the question that I came up with. I actually came up with 2 questions for that I would like to pose to the class. What do you see as a challenge in working with pediatric end-of-life care? Or how would you take care of yourself so that you can continue to care for others? Thank you for listening to my presentation, and I hope it was informative and you all enjoyed and got something out of it.